Thank you for inviting me today to speak to you on the potential safety issues related to the use of U-500 insulin. U-500 is a concentrated insulin. It is 500 units per ml. The insulins with which we're most familiar, NPH, glargine, aspart, regular, they're all of a U-100 formulation, which is 100 units per ml. U-500, therefore, is 5 times as potent, 5 times as concentrated than the insulins with which we're most familiar. Interestingly, U-500 is designated pharmaceutically as a regular insulin. It is clear, without additives, and it also has a pharmacokinetic profile similar to NPH. In that way, it differs from the U-100 regular insulin. So why would we have an insulin that's this concentrated? Some diabetic patients have such severe insulin resistance that in the course of the progression of their disease, they will find themselves self-administering 200 to 300 units of insulin a day. And that can be a combination of both a basal insulin and a prandial insulin, but the amount that they have to inject does approach that 200 to 300 unit mark. That becomes impractical or a little more difficult if one has to inject 2 to 3 times at one sitting, since an insulin syringe can only handle 100 units of insulin. So with the U-500, we have a more concentrated form that allows a reduction in volume and less injection shots that are needed during the course of a day. So with U-500, we have an insulin that insulins of themselves, by themselves, are designated as a high-risk, high-alert medication. And now we've added to it another formulation which is 5 times as potent. Therefore, I wanted to spend a few minutes going over 4 points that I think might be beneficial to prescribers and providers, pharmacists and nurses, if they find themselves in the course of a day handling either a prescription or the medication itself. The 4 points I'd like to mention very briefly are incorrect prescribing and directions of use for U-500, which is closely linked to the second recommendation, which is inappropriate selection of a syringe. Thirdly is the unsafe storage amongst an inventory of other insulins by a pharmacy. And then finally, we must all be aware of the potential for severe overdose and hypoglycemic episodes and how to treat those patients who might find themselves in too much of a hypoglycemic state as a result of U-500 use. I mentioned first the incorrect prescribing. The recommendation is that U-500 prescriptions should always be issued by volume in mLs. They can also be issued with units, but mLs and volume should always be part of that prescription. The reason for that is tied closely to the second recommendation, which is the use of a syringe which is calibrated by volume in mLs. In our case, we would recommend either an allergy syringe or a tuberculin syringe. All of the syringes we use for U-100 insulins, the markings, the calibrations are by units. So we could find ourselves in a situation where a prescription is written in units with U-500 and the patient inadvertently uses an insulin syringe which is also by units, and the units of an insulin syringe and the units of U-500 do not equal each other. As I mentioned, U-500 is 5 times as potent. So to limit and mitigate the chance of error with the prescribing and self-administration of U-500, the recommendation is prescriptions always issued by volume in mLs, and the appropriate syringe selection would be either allergy or tuberculin syringe. Third point was that the pharmacy should always make sure that U-500 is stored separately from all other insulins within its inventory, and also the recommendation would be that the tuberculin or allergy syringe be stored adjacent to the U-500 to help with the proper selection of syringe. Finally, with U-500, if there is an overdose, the hypoglycemia that is experienced could be prolonged and severe. So the patient, nurses, doctors should all be aware that initial correction of a hypoglycemic episode in a patient using U-500 is just the beginning of treatment, and we should be prepared to treat and replete glucose for an extended period of time in any instances in which an overdose is noted. I want to thank you very much for inviting me to speak on U-500 today. Thank you.